Hi, I'm Dr. Roseanne Freak-Poli. I had a bit of media interest this morning in my work and I didn't get across all of my points, so I thought I'd put together a slightly longer video to explain my research. My research is funded by the National Heart Foundation of Australia and Monash University. I followed nearly 11,500 healthy older Australians that were originally recruited for the ASPREE trial. ASPREE stands for aspirin in reducing events in the elderly. They were healthy because they had never had a cardiovascular disease event or dementia or any severe physical disability or anything else that would prevent them from surviving for the next 5 years. All the participants were aged 70 years and older. I found that the healthy older adults that reported having lower social health, particularly lower social support, had double the risk or 200% greater increased risk of cardiovascular disease over the 5-year follow-up period. I also found that the healthy older adults that had social isolation at baseline or when they initially recruited to the study, they had an increased risk of 66% for cardiovascular disease incidence over the 5 years. Interestingly, in this group of healthy older Australians, social support and social isolation were more important than loneliness for cardiovascular disease risk. Now, the definitions that we used for social support and social isolation are quite important. The way that we termed having social support was at least 5 friends that you could discuss private matters with or call on for help. So if you have 3 friends that you discuss private matters with and 2 of them you can call on for help, then you'd be satisfying what we would consider having high social support, and that would reduce your cardiovascular disease risk. For social isolation, it was more about contact with people. We defined social isolation as being engaged in a community activity less than once a month and having 4 or fewer friends or close relatives that you see in a month. So if you want to decrease your cardiovascular disease risk, then you can simply see more people, engage in more community events, but also really think about fostering some relationships and discuss private matters with these people. Now, importantly, we know that there's a huge range of risk factors for cardiovascular disease. If we go to the doctors, they will assess your cardiovascular disease risk profile. This includes things like your lifestyle choices, such as smoking, as well as your biometrical data, such as systolic blood pressure. Very importantly, I adjusted or accounted for all of these factors that we commonly use to look at your cardiovascular disease risk profile, and the social connection and social support was still associated with cardiovascular disease risk. So therefore we can, doesn't matter what your cardiovascular disease risk profile is at the doctors, we know that social support is something that you could improve to decrease your cardiovascular disease risk. So now that we're coming into the festive season and out of lockdown due to COVID restrictions for many people, it's a really great opportunity to reconnect with people and perhaps take up some of those relationships that you used to do face-to-face again. It's also a great opportunity to think about in 2022 some interests that you may not have engaged in, that could be group activities, and potentially meeting new people that share similar interests with you. Thank you.